when we're trying to improve rib cage expansion, we need to think about how our rib cage works. So as we inhale, we breathe in, the pressure goes down, diaphragm starts to push down, we create this transdiaphragmatic pressure, belly expands, rib cage starts to expand, intercostals start to relax to a certain degree. Some are pulling to tilt that rib cage up, allow us that expansion. And this is not just coming from an anterior to posterior, so front to back. We're also getting this lateral expansion here. So as we breathe in, extends, and we also get some thoracic extension here. Now, when we are restricted a little bit, sometimes those ribs won't really expand out or displace themselves away from each other a little bit. And so what that's going to cause is, it's going to cause us to drive a lot more thoracic extension. Now, one thing that's often very commonly done is diaphragmatic breathing. You know, whether that's sitting, laying down, whatever it might be, working on breathing helps kind of work that respiratory fluency of getting expansion from more of a mechanical standpoint when we're talking about our musculoskeletal system, because the musculoskeletal system really helps drive our ability to get as much air in and out. Now, when we're working on it though, we don't want to just work on breathing laying on the ground or sitting. We want to integrate it and progress it from the ground to standing. One thing we like to do is we like to go from, once we've gone from the ground position, is then to get into a half kneeling position, because this is very similar to walking in a sense of one leg forward, one leg back. Now it's slightly, different in a sense of when we start to move. However, it's a good progression. Now, something we like to work on though before we start to add lots of movement is, let's get the system breathing within more of a static position. Now, breathing is very dynamic, especially when we're talking at a very micro level. Lots of muscles moving and stuff like that, so it's not necessarily static. But when we're talking about peripheral, arms, legs, the whole system, we want to start in more of a stable position, allow that dynamic fluidity to course its way through and then integrate. So what we like to do from a half kneeling position, we have a foam roller. You can use a yoga block, whatever, a pillow, something that's just going to give a little bit of stable base. And we want to think half kneeling position, more of a 90-degree angle in the knee, the hips. This is going to go into the wall. We're going to push a little bit in there, okay? From this position, now I have a lower stable base of support. From here, I want to see, where's my rib cage? Am I extended? I want to tuck my rib cage down just a little bit to start. Now, as we breathe, we want ribs to flare a little bit, but we don't want to start in massive extension here, thoracic spine. So from this position, we're just going to push a tad into this foam roller to get a little stable base here. And like I said, I want to work breathing in this pattern before we add to it. So what I'm going to do is I'm going to start rib cage down just slightly, arm overhead if you want. You can just relax it over here, okay? And all we're going to do is breathe in through the nose and then exhale through the mouth. Almost pursed lips, air out. When you breathe in, you're going to try and think about inhalation, 3 to 6 count in through the nose. And as you breathe in, go very slow and controlled, a 3 to 6 count, and really start to try and get that pressure towards that lateral side of the rib cage here. And sometimes if you put the hand here, you can feel that feedback. Nice and easy. And you'll start to see expansion occur. And it's in this half kneeling position, which is a very good transition to standing and walking. So now we're working at a micro level, the expansion in more of a half kneeling position. Because if you think about when I breathe, we have one hip that is extended, one hip that's flexed, very similar to walking. When we walk, we extend and flex the hips on various legs depending on what we're doing. So like I said, we're transitioning this. Now, what we want to think about, it's not just the rib cage, okay? We have to think about that thoracic spine a little bit. Now from this position, if I feel really restricted, I may stay right here. I may not move to the next exercise I'm going to show you, because once again, we want to work on good lateral expansion of the rib cage, not just anterior to posterior extension. So once I have felt I'm getting better movement of more expansion of that rib cage, and this also goes to say when you're exhaling too, if you're always extended up here, then we need to work on pulling this down and work on in more of this kind of neutral position. However, from there, what I'm going to do, I want to work on a little bit of thoracic rotation, because as your spine or as your ribs expand on the back side, your thoracic spine where the ribs connect to, they're moving a little bit. So if your spine is restricted, it's going to also play into the factor of what's happening with the rib cage. So once I feel comfortable there, all I'm going to do from this position is I'm going to rotate towards the knee that's up, come back through. Almost think there's a pull from the top of your head all the way down. I want to be tall, but I don't want to be overextended. So tuck the rib cage down and then rotate away. So I'm pushing my knee into the foam roller going this way as I'm rotating this way. Now these ribs are going to come up a little bit, which is fine, because as I rotate, I want this to come up. So from this position, as I rotate, these will come down a little bit, and these are going to come up a little bit. So it's like this rotation, and then it will be the opposite when I rotate the other way. Okay, so you'll see ribs going up is not a bad thing. We just have to make sure we don't start ribs up and we don't go into excessive positions. So once I've worked on my breathing, push this way, rotate this way. And just think torso rotating versus trying to get too much with the arm. Because if I'm very loose in my arm or my shoulder girdle, I can easily drive more rotation through this range versus this. Remember, we're thinking close to the spine. Only spine movement. Rotate. And we'll just do this 5 to 10 times. So now what we've done is we've worked on getting better lateral ribcage expansion from a half kneeling position. And then we started to see, okay, is it the ribs? Okay, I got some restrictions. Now let's see what happens after I do that. And I go to the thoracic spine, which tends to cause us some restrictions as well. So that's a good progression when we're talking about working on reducing restrictions in the rib cage and then integrating some movement-based stuff to transition us to our workouts or before respiratory treatment. How many times have you been restricted during a respiratory treatment and all of a sudden you feel more mobility or you feel a little bit better? Imagine doing that before the treatment and then seeing what outcome you get out of that. So think about trying that. Breathe first in different positions, on the ground, half kneeling, seated, standing. Feel more comfortable there, then go to your mobility of the thoracic spine so you have a better integration overall.